How long does bladder training take to effectively work? Imagine trying to teach your bladder new habits like training a pet. It takes patience and consistent effort. Usually, bladder training needs at least 6 weeks before you start to see real results. Some programs last from 6 to 12 weeks or even longer, depending on how your body responds. Every person is different, so the time can vary quite a bit. The goal of bladder training is to help your bladder hold more urine and reduce the feeling of urgency. You begin by setting a schedule where you try to urinate every 1 to 2 hours. Over time, you slowly extend these intervals by about 15 to 30 minutes every 1 to 2 weeks. The aim is to reach intervals of 2.5 to 4 hours. This gradual stretching helps your bladder muscles become more flexible and control urges better. During this process, you'll learn about your bladder and pelvic floor muscles. Keeping a voiding diary can be very helpful to track your habits and progress. Behavioral techniques like pelvic floor exercises, which strengthen the muscles that support your bladder, and urge suppression strategies, which help you resist the urge to go immediately, are also important parts of training. Regular check-ins with a healthcare provider can help you adjust your plan if needed, ensuring you're on the right track. Many people experience benefits such as less urgency, fewer accidents, and an improved quality of life. Some studies show that these improvements can last 4 months after finishing the training. But remember, individual results depend on how well you stick to the program, your overall health, and any underlying bladder issues you might have. In the context of bladder health and bladder cancer, bladder training is a safe, non-invasive way to improve bladder function if you have overactive bladder or incontinence. It is important to note that bladder training is not a treatment for bladder cancer itself, which requires medical or surgical intervention. If you have bladder cancer, always follow your healthcare provider's advice for managing your condition. In summary, bladder training generally takes a minimum of 6 weeks to see meaningful change. It involves gradually increasing the time between bathroom visits and making behavioral adjustments, all tailored to your needs. Working closely with a healthcare professional can help you stay safe and maximize your progress. Remember, patience and consistency are key, and everyone's journey is unique.